treatment for your back pain to sort of be minimized for the longest time possible. So spinal injections is mostly of the expertise of the pain specialists, and that includes epidural injections, nerve blocks, sacroiliac injections. And surgery, usually, in my opinion, should be the last resort for back pain. If you do have a problem like incontinence of urine or stool, you're having a foot drop, you're having constant numbness, then that is a reason to, have an assessment and determine if you need surgery. But for only back pain, some people do have spine surgery for it, and many of them do well. Some of them just stay with the pain. So it's something that you want to keep in mind when you're making decisions about what treatments do you want to try. And these are just some examples of some of the injections that specialists can do. This is an epidural steroid injection. This is the same type of injection that women get to have to feel no pain from labor. It's basically a special needle that goes into the epidural space, which is the space before the space that contains the spinal cord. And specialists usually use some sort of X-ray guidance called fluoroscopy to do it. We try not to do it blind. Epidural steroid injections can be done in different ways. There's a type of epidural steroid injection called a selective nerve root block or a transforaminal epidural, and that's a specialized way of doing it. That basically the main reason to do it that way is because you can put the medicine very close to the pinched nerve. Facet injections or injections in the joints that are arthritic can also be done. They're also done with fluoroscopy. This is a needle, and this is a radiological picture of the joint, and you put the needle in. And then you can inject, just like for knees, a little bit of local anesthetic and steroid. Back pain can also be caused from sacroiliac joint problems or arthritic or inflammation, as that's basically a joint that is formed between one of your pelvic bone and your tailbone here, where they join. That's called a sacroiliac joint, and that can also lead to back pain and buttock pain. And we also do an injection under X-ray guidance for that. There's more involved or more invasive procedures to treat severe intractable pain, and that includes implants on the spine people like Jerry Lewis. Anybody ever? He came on TV a couple of years ago because he did very well for his back pain with one of these implants. There's also radiofrequency ablation, which we use heat to get rid of a nerve that gives sensations to joints like the facets that can be arthritic. You have to be a partner with your doctor to treat your pain in order to get the most success. And the things that you can do is exercise, lose weight, stop smoking, and seek help early if your pain is very severe. How many people smoke here? Only one. Wow. Smoking, the way that smoking affects back pain is the following. It robs blood flow to the discs. And when the discs have no blood to nourish the disc, they start degenerating early. And after you degenerate, then you can have problems with the joints, as I mentioned before, pinched nerves, et cetera, et cetera. So, stop smoking. So, if what the pain specialists do, at least that's how I see my practice, is sometimes we cannot eliminate all the pain that you have, but we can certainly minimize it so that it is not the biggest thing in your life happening, and you can enjoy the scene and make pain just minimize or a small part of your everyday life. Acupuncture, it is useful for back pain and for arthritis, for musculoskeletal pain, any kind of muscle strain or sprain. There are medical literature to support the use and its effectiveness. The main hurdle for some people is it's not covered by Medicare. It's not covered by many insurance. And for chronic pain, you probably need to invest in 10 treatments. For something acute pain, just a few weeks, within 3 treatments, you can see some results. And the way that works is the needles activate your endorphins, which is your own pain reliever substances in your body, and that leads to reduction of pain. That's one of the theories behind the use of acupuncture. There is no big study that says that is effective. In terms of nerve kind of pain, stenosis being can be neurogenic pain by squeezing in the spinal cord or pinching one of the nerves that come from it. There is limited studies about if acupuncture helps or not. The X-stop is used for spinal stenosis. Basically what happens is that X-stop is a piece of metal. It's a surgical procedure, so I do not do it. But it's a piece of metal here that you put between these 2 bones, and those are called the spinous process. And when you have that metal, then it eliminates your motion back. And when you do that, then you cannot compress the spinal cord or the nerves. So it relieves the pain by decreasing the amount of movement, the extension of the spine at that level, so that you cannot pinch the spinal cord or the nerve any further. Well, thank you for your attention.
This program was brought to you by the Boca Raton Community Hospital Foundation. Imagine what we can do together.